listening to What's Your Wrinkle with Dr. Arthur Perry. What's your wrinkle?
And we are back. This is Dr. Arthur Perry, and this is What's Your Wrinkle right here on WABC. All right, so everybody is talking about Ebola. Everybody's talking. It's everywhere. It's on every news show. It's absolutely everywhere. And so I asked Patricia Whitley-Williams, who is a professor and the chairman of pediatrics at Rutgers at the Robert Wood Johnson Medical School. She's a physician-in-chief at the Bristol-Myers Squibb Children's Hospital at Robert Wood Johnson. She is an absolute world's expert in this topic. So thank you for taking your time, Dr. Whitley-Williams, on this Saturday evening. Are you there?
Yes, I am. Thank you very much for asking me to join in.
Well, we need a sane voice because there are so many people that are saying all sorts of things about this Ebola. And, it's natural for people to get panicky, but I wanted you, to really shed the light and give us the truth about it. Why has Ebola captured so many headlines recently?
Well, certainly everybody is talking about Ebola. And I think they are because this is the first time we have had Ebola on U.S. soil. I'm not an expert in Ebola, but I am an expert in pediatric infectious diseases. And it's something we learned about and we hear about all the time. So it really strikes fear when we hear that there is Ebola here in the U.S. But in reality, we really need to calm down and do not panic. First of all, the cases here that occurred so far the two nurses from Dallas that were exposed to the original case. Both of those patients survived. And unfortunately, the original index case actually became infected with Ebola overseas, not here. And as we all know, probably presented too late, and unfortunately there was a demise. But so far, all the cases of Ebola that have occurred on U.S. soil have survived. Yes, it is highly infectious, but it is not airborne. Otherwise, I think we would be seeing many, many more cases. So people need to calm down and just really pay attention to asking those important questions when someone actually presents to a healthcare facility, and that is certainly what are their symptoms and what is their travel history and where have they been, just to identify if they are at risk.
And I'm speaking with Dr. Patricia Whitley-Williams, the chairman of pediatrics at the Robert Wood Johnson Medical School and Robert Wood Johnson University Hospital. And we're talking about Ebola. And I'm sitting high atop Madison Square Garden. There's millions of people within a few blocks of me. So it's very good what you're saying. It's not airborne. People have to just kind of chill out a bit. No one is going to get Ebola if someone sneezes across the street. How do you get Ebola? Who's at the greatest risk for that?
Well, certainly anybody who is in contact with the secretions, the blood, the body fluids, the secretions of a patient who is infected with Ebola. So, for instance, the physician who returned from Guinea, having cared for patients with Ebola, initially he had no symptoms, and then on the day that he develop symptoms such as fever, he is presenting right away to the healthcare facilities. So in terms of whom he exposed, yes, the people who were living with him, who were close to him, certainly they're at risk, and I understand they are being monitored and quarantined. But other than that, the people on the subway, that he rode with when he was having no symptoms, they're not at risk. He was not symptomatic yet. And probably the people in the bowling alley that he was with. Again, he was not symptomatic until that day that he developed the fever. He called right away and was taken in and isolated. So we do get hysterical when we think about exposing so many people on the subway, et cetera. But there is almost no risk or theoretical risk if the patient is not symptomatic. and there is no contact with body fluids or blood. So in other words, he'd have to, be vomiting over someone or having cut his hand or something, and that person being next to him being exposed to the blood. So it really, those people are safe.
And that's so important to understand. The people that have gotten the disease in this country had direct exposure to the body fluids of Ebola patients. They weren't on the subway. They didn't handle the bowling ball of the person who had it. So very, very important. And you were at Robert Wood Johnson, which was designated as one of the hospitals in New Jersey. There's only a few hospitals that are considered good enough, and I'm happy to be part of Robert Wood Johnson, good enough to handle patients. Heaven forbid if there are more, Robert Wood Johnson can handle those patients. Thanks so much for taking your time this evening, Dr. Patricia Whitley-Williams, the chairman of Pediatrics and a pediatric infectious disease expert at Robert Wood Johnson University Hospital. I want to give out the number of Robert Wood. We got just a second. 888-MD-RWJUH. 888-MD-RWJUH is the phone number if you've got any questions about Ebola or about any illness that you might have. This is Dr. Arthur Perry. You've been listening to What's Your Wrinkle right here on WABC. Thanks so much. We're going to be back next week. And boy, the board is absolutely filled. Regina, Barbara, everybody else, please call at 6 o'clock next week. Thanks so much for great engineering. We'll see you all next week.